I am Dr. Claire Vega, and I need you to think carefully about what you did this morning before you sat down with your coffee. You opened that pill bottle. You shook out your blood pressure medication. You swallowed it with your first cup of the day because your doctor told you years ago that morning was the right time to take it. Your doctor gave you advice from a completely different era of medicine. That advice is leaving your brain and your heart entirely unprotected during the most lethal hours of every single day. By the end of this video, you will understand exactly why the timing of that pill matters as much as the pill itself. You will understand what is happening inside your cardiovascular system between 4 and 10 in the morning. And you will have the exact words to force your doctor to change your prescription schedule this week. I need to start by explaining a biological process your doctor has never taken the time to describe to you properly. When a healthy person falls asleep, their blood pressure drops naturally by 10 to 20%. This drop is not accidental and it is not optional. It is a mandatory biological reset that your cardiovascular system requires every single night to survive. During those hours of reduced pressure, your blood vessels perform critical maintenance work. The microscopic damage caused by the physical stress of daytime activity gets repaired. The arterial walls recover their elasticity. The tiny vessels deep inside your brain receive the low-pressure environment they need to clean out metabolic waste. Scientists call this the nocturnal dip. And if you are a senior citizen on blood pressure medication, there is a very high probability that you are not experiencing it. The pill you swallowed with your morning coffee has a finite duration. By the time you sit down for the evening news, that medication has largely degraded in your system. By the time you turn off the bedroom light, it is providing almost no protection at all. Your blood vessels spend the entire night under the same crushing pressure they experience during the day. The tiny vessels in your brain are being hammered continuously for 8 hours with zero relief. Over months and years, this relentless overnight pressure causes what researchers call silent cerebrovascular events. Small zones of damaged tissue accumulate deep inside your brain without producing obvious symptoms. Your doctor looks at your annual cognitive screening and tells you the slight decline in your memory and processing speed is a natural consequence of getting older. They completely ignore the fact that your brain spent thousands of nights under unrelenting pressure because your medication schedule was established out of administrative convenience rather than biological logic. Now, I need to explain what happens in the hours before you even open your eyes. Around 4 in the morning, your body begins preparing for wakefulness. Your brain releases a concentrated surge of cortisol and adrenaline into your bloodstream. These hormones force your heart to beat with increasing intensity. They instruct your blood vessels to constrict in preparation for the physical demands of the day ahead. Simultaneously, your blood undergoes a chemical change. Your body increases its production of clotting factors. The blood becomes measurably thicker and more adhesive. This biological preparation exists for protective reasons, but in the context of uncontrolled blood pressure, it creates a profoundly dangerous combination of conditions. You have blood that is thick and prone to clotting. You have blood vessels that are constricted and narrowed. You have a heart that is beating harder with every passing minute. And you have zero medication remaining in your system to moderate any of it. This is the morning surge, and it kills people every single day. 40% of all fatal heart attacks occur between 6 and 10 in the morning. The overwhelming majority of crippling strokes happen during these exact same hours. You wake up, your legs swing over the edge of the bed, gravity demands an immediate cardiovascular response, and your heart attempts to push thick, sticky blood through constricted vessels with no pharmacological support whatsoever. Your doctor knows this data. The clinical research on the morning surge has been published and replicated for over a decade. They choose not to apply it because changing a prescribing habit requires effort, and the current system generates the same revenue regardless of whether you survive your morning. Let me tell you about Dennis. Dennis is 74 years old. He spent 30 years as a high school principal. Sharp, disciplined, organized man. He took his lisinopril every morning at 7:30 without fail for 11 years. He never missed a dose. He believed he was managing his condition responsibly. 18 months ago, Dennis woke up on a Tuesday morning and felt a strange heaviness behind his right eye. The room seemed slightly tilted. He sat on the edge of the bed for a few minutes and the sensation passed. He assumed he had slept in an awkward position. He drove himself to the grocery store an hour later. By the time he reached the cereal aisle, the right side of his face had gone completely numb. Dennis survived the stroke, but the right side of his body required 8 months of intensive rehabilitation before he could button his own shirt. His neurologist reviewed his medication history and noted the morning-only dosing schedule without comment. No one explained to Dennis that taking his pill at night might have prevented the event entirely. No one mentioned the Hygia chronotherapy trial. No one accepted any responsibility for 11 years of dangerously outdated advice. Dennis asked me why nobody told him. I told him the honest answer. Because telling him would require admitting the protocol was wrong. And the medical establishment protects its own credibility before it protects its patients. I want to tell you about the largest clinical study ever conducted on blood pressure timing in human history. The Hygia chronotherapy trial tracked over 19,000 patients across 6 full years. Researchers divided participants into 2 groups. The first group took their complete blood pressure medication dose every morning as traditionally prescribed. The second group took the identical medication at the identical dose every night before sleep. The results were so decisive that the researchers published them with an unusual degree of urgency. Patients who took their medication at bedtime reduced their risk of dying from cardiovascular disease by 45% compared to the morning group. They reduced their risk of stroke by nearly 50%. They reduced their risk of heart failure by 42%. The same pill, the same dose, the same patient. Twice the protection simply by changing the hour of administration. Taking the medication at night restored the natural nocturnal dip that morning dosing was suppressing. It ensured the medication reached its peak concentration in the bloodstream during the morning surge, the exact window when the cardiovascular system is most vulnerable to catastrophic events. The pharmaceutical companies that manufacture your blood pressure medication have no financial interest in sharing this information with your doctor. They earn identical revenue whether you take the pill at 7 in the morning or 11 at night. Your survival does not appear on their earnings report. Your compliance does. Most practicing physicians have not incorporated this research into their prescribing habits. They rely on pharmaceutical representatives and continuing education materials funded by the same companies that profit from your prescription. Independent clinical breakthroughs that require no new product and generate no new revenue receive almost no distribution through those channels. Now, I am going to describe the specific warning signs that tell you the morning surge is already damaging your cardiovascular system. Pay careful attention to your body during the hours between waking and mid-morning. The first warning sign is a dull, persistent pressure at the base of your skull, exactly where your neck meets the back of your head. This is distinctly different from an ordinary headache. It feels like a deep, throbbing weight that is present when you first wake and intensifies when you stand up. This sensation indicates that the vessels supplying blood to your brain are working under extreme pressure during the surge window. The second warning sign is visual disturbance that persists beyond 10 minutes after waking. You open your eyes and the room remains slightly blurred, or you notice a subtle flickering at the edges of your vision. The optic nerve is one of the most pressure-sensitive structures in your body. When morning vascular pressure is uncontrolled, the optic nerve signals the disturbance before you feel it anywhere else. The third warning sign is a specific quality of morning exhaustion that is disproportionate to how long you slept. You slept 7 or 8 hours. You stand up from the bed. Your legs feel profoundly heavy, and your chest feels tight before you have taken 10 steps toward the kitchen. This exhaustion is your heart communicating that it is working extremely hard to push thickened blood through constricted vessels against the full demand of gravity and physical movement. If you recognize any of these 3 patterns in your own mornings, your current medication schedule is failing you during the hours it matters most. There are also 3 specific nighttime habits that actively prevent your body from achieving the nocturnal dip even when medication timing is corrected. These saboteurs keep your pressure elevated through the night, and the system has no financial incentive to warn you about any of them. The first saboteur is sleeping on your back if you have any degree of sleep-disordered breathing. When you sleep flat on your back, the muscles supporting your airway relax and the passage narrows. Breathing becomes effortful. Your brain detects the reduction in oxygen and releases adrenaline to force a deeper breath. That adrenaline surge elevates your blood pressure sharply and repeatedly throughout the night. Sleeping on your side keeps the airway structurally open and eliminates this chemical trigger entirely. The second saboteur is aged cheese consumed in the evening hours. Sharp cheddar, Gouda, Parmesan, and similar aged cheeses contain high concentrations of a compound called tyramine. Tyramine directly stimulates your adrenal glands to release catecholamines, which are the same class of hormones responsible for your morning surge. Eating aged cheese after 7 in the evening creates an artificial hormonal environment that prevents your blood pressure from dropping during the night, regardless of what medication you have taken. The third saboteur is exposure to broadcast news programming within 2 hours of sleep. Television news networks are engineered specifically to generate sustained psychological arousal in their audience. Fear and uncertainty are their primary product because an anxious viewer watches longer and clicks more advertisements. Your brain processes the threats presented on that screen as genuine physical dangers. Your nervous system remains in an elevated activation state for hours after the television is turned off. You lie in bed feeling tired, but your cardiovascular system is operating as if you are still responding to a threat. You must eliminate all broadcast news before 9 in the evening without exception. Now, I am giving you the exact words to use at your next doctor's appointment. You are not going to ask for permission. You are going to present a clinical position and require a response. You will say the following: you want to transition your blood pressure medication to evening dosing in order to restore your nocturnal dip and provide peak concentration coverage during the morning surge. You need them to outline the safest transition protocol for your specific medication and dosage. If they express resistance, you will ask them one question only. You will ask whether they are familiar with the published outcomes of the Hygia chronotherapy trial and its findings on bedtime versus morning dosing in hypertensive patients. If they cannot answer that question with confidence, they have demonstrated that they are prescribing your cardiovascular medication without reading the current scientific literature. That information belongs to you. Use it calmly and without apology. If they are on a diuretic as part of their regimen, the transition may require a dosage adjustment or split schedule. That is a reasonable clinical discussion, and a competent physician will engage with it honestly. You are not their passive patient. You are a person who has read the research and deserves a prescribing schedule built on current evidence rather than a habit formed in the 1950s. The entire structure of the medical system depends on patients who do not ask questions. They depend on you accepting the morning pill habit because it has always been the morning pill habit. They depend on you interpreting your morning headaches and your morning exhaustion as the normal experience of aging. They depend on you never connecting the dots between the hours your medication is absent and the hours your heart is most at risk. You have connected those dots now. Dennis connected them after a stroke took 8 months of his independence. You are connecting them today, before that morning ever comes. Take your pill tonight, 1 hour before sleep. Give your brain the protected night it has needed for years. Give your heart the coverage it deserves during the most dangerous hours of the day. I am Dr. Claire Vega. I am reading the buried trials and handing you the conclusions they suppress. Hit that subscribe button right now, because my next video exposes the standard cholesterol test your cardiologist orders at every single appointment. The test contains a fundamental measurement flaw that causes physicians to prescribe statin medications to patients who do not need them. You need to know which panel to demand instead before you sit down in that examination room again. I am Dr. Claire Vega. I will see you in the next video.